Good evening, everyone. Welcome to the Science of Uncertainty. Today, I am going to tell you something different. How a doctor can be a magician and an artist and a mathematician. So, as you people have just passed out your undergraduate course, and you were very safe till now, you were thinking that everything is structured because till now everything has been given to you in a structured way. The anatomy had names, physiology has got formulas, surgery had got steps, pathology has got definitions, fine classifications. So all those things were there. And you also were thinking in a different way, like I have answer to everything because once I go and read from the books, I'll be able to memorize it and I'll be able to write it in my examination. Yes or no? Yes. Till now, you were playing safe and you knew that I have answer for everything. Now, in your intensive, you had come across many things which you couldn't understand because there was no one to tell you. I know. There was no one to tell you what's going on because you were there just for 2 to 3 months and you were there just to do the paperwork. You were just a helping hand for people, for doctors who were working there. You never understood what's going on in the pediatric ward, what is going on in the surgical ward, what's happening in the medicine ward, because you have to complete. And in, back of your mind, you had one thing very clear that you have to sit for your post-graduation examination. You have to crack it, and so that you will get a seat in your post-graduation. Now that time is over. You did your best. You got a seat in this post-graduation, and now you are moving around the world. Since last 1 and 2 months, I can see you, your face confused. What's happening? How the things, I know I'm now MBBS, but why my seniors are telling like this? Why they're telling me to be in the ward? Why the doctors are telling me that my consultant is telling me to do this, do that? And you do not have any answers. And you have a great hope also. Because you want to become like your boss. You want to become a great physician, a great surgeon, a great radiologist, a great gynecologist. Yes or no? So, till now the things were very safe. Till now also it's okay. Now you have stepped into a world of post-graduation where you are going to be trained for the future so that in future you will be treating patients. So this is a grinding machine. Post-graduation is a grinding machine, you can say, where all of your good qualities will come up. And at the end you will find that you have become a magician, you have become an artist, you have become a mathematician, and you have become a good human being. Now this thing, till now you people must have heard about an artist and a magician and a mathematician. You think they are all individual professionals and they are good in their own field. But my dear, I'll tell you one thing is very important thing I'm telling you. A doctor is a mixture of so many professionals because you are the best. You have come after, I think it is in millions, when millions and millions people are giving exams, and out of you are the gold. And when you get you become a valuable product, people expect more from you. And because you are the best, you're the best of the brain available. And you know what's happening? Now the things is happening that you have to prepare yourself now. Now I'll take you a journey, how you will become a magician, how you will become a artist also. Every doctor, if I'm standing here, I am all of the things. In my rounds, when I see a patient walking towards me, or I see a patient in the emergency, I put my hand before any investigation has been done and I tell the diagnosis. You people must be getting surprised, Many times people ask me, how could you diagnose a patient just by putting your hand? just by seeing a photograph. How can you diagnose all those things? When I talk about Dr. Kakkar and the physician, and when he sees ECG or he talked to the patient, he understood, he have something in his mind, and ultimately it comes to be the true after the investigations. So all these things are possible. All these things are possible because you are going to be a magician. You are going to do magic. You know what a magician does. What a magician does, I tell you. Magician comes before coming to the stage, he creates an environment of magic. What is that environment? He comes with a proper costume, He comes with a proper costume to attract you, so that your eyes will be focused to that. He created different environment, lights are dim, and there's a soft music playing on, and there is a silence everywhere. And he makes the audience anxious. And that's the first step a magician does. What do? We have also our costumes. Whenever we enter to the patient who is in pain and agony, we come with a stethoscope. We come with a white coat. We come a calm in our face. And we have an environment where the machine, the things, ECG machine is there, a pulse oximeter is there. All the environment we create the patient to expect a magic from us. And they are not wrong. Or we are not magician. Not that you are not magician. We are magician. Because remember one thing. The patient has not come reading a textbook that my disease will be like this. I will come with these symptoms to be diagnosed with this named disease. Because the disease which the patient has come, he doesn't come with a name. Fine. So, but you go there. The things are different now. Now you go there with your set and you start touching him, taking the pulse. Fine. And you divert the focus. You start a saline, you give an injection, and you talk to the patient. And the magician, whenever he is doing a trick, what he does? He goes on talking. He goes on talking to people, to the mass, so that people's attention is there in their hands, in his eyes, in his stick. Yes or no? So, when we enter, when the person is in pain and agony, we go with all the things without our knowledge. We do not know we are going with so much of things, and we are going to perform a magic. Nobody has told us. No, I don't think anybody has told you till date that you perform magic every day. I do magic every day. Since 30 years, I've been doing magic only. Nothing different. There is no difference. Only that thing is that in the magic performance, they do tricks. Here, we do the reality. And after 5 minutes, 10 minutes, 15 minutes, the patient starts coming down. He starts feeling good. He now have full faith on you. Whatever you want to do, you do it. You know that? Have you ever seen that experiment that a lady has been put in a box and a lot of knives have been put from every side, and that girl, while smiling, he goes into that box. And when I was a kid, I used to think, what is happening there? How come this girl is going there and to get all the knives and things to be put on in his or her body? Now I realize that our patients are nothing but those smiling girls, those people, those girls who comes to us, the patient who comes to us with full faith that yes, if I go to doctor, the doctor is going to give me a relief. And that's how we are magicians. We have a magic wand in our hand, and that is our stethoscope. And the patients. So don't you think you are doing magic every day? Are you anyway less than a magician? No, you are not. No way you are less than a magician. You are as good as a magician. And the more tricks or the more you become experienced, the more you are going to create magic. That's what I wanted to tell you today. A magician performs his magic for the benefit of his own company or for name and fame and this thing. We also do magic to gain a name and fame and things. But here we are doing some very constructive work. We are different from those magicians who just do a trick. Now we are serving people. We are not just entertaining them. We are serving people. And remember this, the more you think yourself to be a magician, the great doctor you are going to become. And that is sure. But you have to develop that confidence that when I'll go, I'll perform magic.